All right, we're gonna start with part two of chapter 13. There will probably be a part three. We'll see how much we get into today. All right, I'm also gonna set my timer on this on the back end where you can't see. All right, let's get into this. Continuing on with fundamental technique, we're going to talk about equipment safety and environment. Maintaining a controlled environment is the foundation of injury prevention. You won't always have the biggest say, the biggest pull, the biggest budget as a trainer on what goes on the floor. However, we're going to teach you how you can make really good recommendations. And as long as you speak your piece and you let people know what's going on, then that's the best that you can do. And make sure when you take your client to a certain equipment, an area, that you do your best to make sure that it's safe. For hazard management, we want a clear workspace. It's our responsibility to keep the floor clear of loose plates, barbells, dumbbells to prevent trips and falls, and trash too. If you see a piece of trash in your gym, pick it up, make the place better than what it was when you came in. Equipment security, always use collars or clips. That's what's in this picture right here on barbells to ensure plates remain secure and the load stays balanced. So it's not just for safety, it's also for balance. When we are pushing and pulling with these barbells, we might push in an uneven path, and that means the plates can slip to one side. We don't need that happening. So please clip up the plates and be cognizant of this as well if you're doing any videos. So if you're posting for yourself on social media and you have the certification and you rep NSCA, would definitely suggest clipping up your weights the most that you can. Also, you're going to be influential as a trainer. You're going to be more influential than you ever will know. And just because you're doing something on a video, someone might take that and copy you, and might be nice to have those clips. It's not our responsibility what people do, obviously when they copy us, but we want to be good examples. Secure handling, remember a closed grip, so not a hook grip, but the thumb wrapped around is recommended for both clients and trainers to prevent equipment from slipping during use. Spotting technique and communication. Over the weekend, we went over how to spot a squat. In order to spot a squat, you stand behind the squatter, assume a squat position, you squat down with them and squat up with them, and your arms are extended in front of you, right under their armpits. Not necessarily touching, but you're really, really close. When you need to come in and save them, that's when you push up on their armpits, push up on their upper back. When we're spotting, we want to spot at the wrist, not at the elbows. You spot the closest you can to the weight. Please never spot at the elbows. For injury prevention, we are, when we're spotting, we're in athletic position. We're protecting our own body by having our knees flexed, spine in neutral position, and abdominals fully engaged. And then our strength assessment is we want to make sure that we're programming correctly. So if we're in a situation where we need a spotter, it should be like a 1RM or the end of a set, and it should be any other reason. Proximity, when we're spotting, we keep our hands as close to the weights to the client as possible so we can react quickly without touching them or actually obstructing their natural path of the exercise. If they complete the lift, we don't want to be any part of that. In this picture is a good reminder of how to spot for bench. You straddle and then you alternate your grip. Spotting provides physical assistance to clients when completing exercise to help reduce the risk of injury. 4 freeway exercise conditions require a spotter. So if they're doing a shoulder press over the face, would be a seated shoulder press. Standing, of course, if you can spot that and you're taller than your client or just as tall, with the bar on the upper back and shoulders, so a back squat, and with the bar position on the front of the shoulders or clavicles, front squat. There's other things that we can spot. The biggest takeaway from this slide is keep hands close to the bar, make sure you have the right grip, make sure you have the right spotting technique, make sure we're programming right. We do not spot any power exercises. So no power clean, hang clean, push jerk, high pull. Olympic lifts, the first thing that they learn, or you will learn if you take USAW weightlifting certification, or if you're learning Olympic lifts in general, one of the biggest things they emphasize is how to fail the lift. You never have a spotter. You use these plates called bumper plates that bounce when you drop them. Additional spotters are necessary when the load is beyond the trainer's ability to handle effectively. So that maybe you can bench as much as your client, but can you bicep curl that up or pull it up in a spotting position? Maybe not, right? So you might have to have additional spotters. Communication is responsible of the client and personal trainer. The client should identify, like, hey, when they want to lift off the bar and then when they want to have assistance during the lift. You can always ask your client, hey, on these last couple of reps, do you want me to help you get it back up or do you want me to just pull it off of you? And helping them get it back up to the original spot is called a forced lift. And then if you're just saving them, you're just saving them. The personal trainer can assist the client re-racking the bar, especially if you're spotting, you have to make sure that they're re-racking the bar completely. Fundamental technique continued is active communication. So we're doing a preset briefing. Always discuss the target number of reps and the level of assistance required before the client starts the movement. So if you are attempting a 1RM or you are getting to that heavy last set, say, hey, client, we're going to do 6 reps and I'm going to be right here in case anything happens. Is that okay? Or something like that. Or, hey, the 6 reps, I'll spot you on the last 2. Or do you want me to spot you on the last 2? Second point, timely intervention. Assist the client immediately if the predetermined speed of the movement decreases. So establish with your client when you're going to come in and get that bar, indicating the onset of fatigue or failure. So have constant vigilance so that you know when the muscles start shaking or they start shaking or they start looking at you, they start losing form. Maintain total focus on your client's form and equipment path until the weight is safely wrapped. The weight. Moving on, we're going to talk about hands-on techniques. It is never appropriate to touch anyone without their consent when we're in a clientele, a professional setting, when we're personal training. We're not talking about anything else besides personal training, right? So personal training, always ask for verbal permission before touching. Respect a no. So if they say, no, I'm not comfortable with that, okay, no worries. We don't have to cue using our hands. We could easily use tons of other tools. Yes, hands-on technique really can help, but some people are not comfortable with that, and that's completely fine. Hand placement. So when we're pointing, just in general, and when we're palpating or touching someone, we want to use 2 fingers instead of a single pointer finger. Kind of like people who work at the airlines, right? We're using our 2 fingers. It seems less invasive, and we're always maintaining a confident but respectful pressure that is easy for the client to track. If you do decide to put hands on your client, hey, is it okay if I touch you? Okay, I'm going to palpate your lats right here. Have a confident touch. If you have any anxiety, they're going to feel that energy and they're going to have anxiety. So be confident with what you're doing. If you're new to cueing and it feels a little awkward, that is okay. And the more you practice, you'll get better at it. Different types of tactile cues is maintain touch. So this happens a lot like with TRX or like if you're teaching a different type of movement or a lunge. I'm going to keep my hand here and you press your knee into my hand the whole movement. There's palpation. So this is when we're like looking for a pulse too. That could be a good example of palpation. You're feeling around for something. Or we're looking to do a skin fold test and I'm looking for the acromion. Knife edge is you're using the pinky edge of your finger and your whole side of your palm. So like a chop, using the side of your hand to guide a broader movement or to drag it along a certain area or something like that. Move away is you're encouraging the client to shift their body away from your touch. So like, don't touch me, don't hit me. Sometimes like with Olympic lifting, we put like a bar to the side of somebody, make sure they don't hit the bar. And then moving towards is, hey, I want you to move towards a specific part, towards my fingers. This is a great example of using that confidence and that technique. Moving on, trainer body position. We want to be on the same level as our client whenever possible. So what does that mean, right? If they're doing a plank, we're taking a kneel. We're doing a low squat. As much as you can meet the eyes of your client, change level with them. Now, this doesn't mean if they're doing a rope climb, you're climbing right under them, right? But we are, for the most part, change level with them. Spotting techniques in your body position will vary depending on client skill and the amount of weight lifted. So just be aware. When we are coaching, we're considering the following when positioning our body and hands: client safety, alignment, comfort, and body awareness. We want to look like this last picture here: open body and open attitude. This is a visual thing, right? Of course, this person on the left with crossed arms could be the most open person we've ever known, right? However, this is a visual image thing. It's a first impression thing. It's a professionalism standard, or what have you. We don't want our arms crossed ever when we're training. Our hands are held behind our back or open at the sides, like this last picture, or on a clipboard. They could maybe a hand in a pocket, one hand out is appropriate, but open body position, the front of the body should be open. And it's just an inviting posture. Oh, I can go up to this person and ask them a question. They don't seem closed off. They don't seem judgmental. And again, this is visual, right? But it really does help our client feel more comfortable. Talking a little bit about cueing, we are keeping cues specific and worded positively. Leave out negatives. So instead of saying, don't put your knees in like that again, I want you to push your knees out. Focus on the positive. I would just leave out that whole first part of the sentence. Hey, next time you squat, really focus on pushing your knees out. Pretend like there's a rubber band, you're breaking the rubber band, and your knees are going out. So we're avoiding the don't do that again. Um, just a more positive way of coaching. Sometimes, if your client prefers that you do have a more specific language, adapt to them. But for the most part, instead of focusing on what you don't want them to do, tell them as a cue what to do. Provide only necessary information for correcting your client. Cues should be congruent with your body language. So make sure that this is like being about it, right? So what's coming out of our mouth is congruent with how we're acting, how we're feeling, um, our typical. We're not saying anything that sounds that like it doesn't make sense. We're using our client's name as often as we can. Ask them if they have a nickname. Ask them if you come up with a nickname, if you could use it. Make sure that you have that personalization. Cueing should also promote confidence and make the client feel safe. That's why we leave out negatives. And don't be too hard on yourself if you realize that you said a negative, right? Quote unquote. We understand that it's not you being negative. We're just talking about negative words, quote unquote. Like don't, um, I'm trying to think of another one, maybe like avoid. Instead of saying, hey, avoid doing that next time, say, oh, next time I want you to do XYZ. And then we want to take into account different learning styles. So there's actually new research that um just like discusses this a little further, but in general, remember that everyone learns a little bit differently based off their history, their social circles, their, how they grew up, and get to know the person as an individual, what works for them. Try a couple different cues on them. If it sticks, it sticks. If not, it's totally okay. Different types of cues, kind of like the type of maintain touch, right? Like the types of tactile cues. There's different type of word cues, alignment cues, each joint, educational, informational. Oh, this is really good for preventing osteoporosis, right? Safety cues, breathing cues, a reminder we exhale when we exert. So usually on the concentric portion of the movement, we exhale. That would be the push up on the bench press. And on the eccentric elongating motion, we inhale. Your client could do vice versa if they feel like it, that's fine. But exhaling does help exert. Motivational, affirmational, great job. Looks great. Imagery, cues, visual cues, wrong, right. Remember, we kind of put that in a positive language. And then tactile, which is what we were talking about with touch. With visual cues, visualization can help performance in many ways. So we'll touch on that a little bit later, but very, very cool. Tons of different cues. All right, starting position. There's so many machines. How do I start my client on this machines? Well, one of the biggest things is we want to align the joints. For standing exercise machines, typically the feet are hip width to stack the joints, shoulder width apart, basically very similar. With feet flat on the floor, machines, they typically require adjustment for seat height. Feet should typically be flat on the floor if the machine allows it to be. If not, align the knee joints with the pad. So if a client is seated, their upper limb, so their hamstring should not be hanging off the seat. They should be seated so far back that that what's hanging off the seat is just their calves, basically. So this picture shows a great version. See how her knee joint is aligned with the, oh, let's go back. Her knee joint is aligned with this right part of the machine axis. Her hamstring, there's no, from what, yeah, her hamstring is not going over the seat end. We want the glutes to be as far back as possible. Just like it says in the slide too, both the seat height and pad position should be adjusted to align the joint or joints involved in the exercise with the axis of the machine. This can take some practice. Please grab me, Chris, Ben in class when we're going over these exercises and pull us aside if there's any machines that you want us to go over with. A lot of the machines downstairs are Matrix. We have a couple other different brands. The Matrix machine design follows a lot of the common machine designs too. So if you know how to set up someone in a Matrix machine, you should be pretty good. For starting position, we want to make sure that we have all of these 5 details before we have our client attempt the movement. We're going to let them know the starting position. So our feet are under our shoulders. Our center of mass is balanced for a squat. And then the alignment of each joint, letting them know that the feet could be externally rotated. The knees may go over the toes. The spine stays tall throughout the squat. And then we talk about the movement. My hips are going to translate back during the squat and down. And then as I come up, they're translating forward. And I should feel this in my glutes, my quads. So movement and technique, you're also letting them know what to engage or contract. And then we have safety factors. So with the squat, only squat to you feel comfortable. I want you to squat to this height. I want you to squat to a bench. So letting them know also maybe common mistakes. Make sure that your chest is open, your shoulders are down. Make sure the knees are pushing out as you're coming down into the squat, coming up. So safety factors can be some like common errors. We don't want to front load them with too many things, but please hit on at least one thing for each of these points as you're describing an exercise. Starting position, alignment, movement or technique, safety factors / common errors, and the muscles that they should be feeling this in. Now, when you're first talking about this, maybe you just do four of these or three of these, but as they go through a couple reps, or maybe the second set, is when you can drop in that fourth one or that fifth one too. So it could be a lot of talking. Try to get a couple spiels, or like that's like a mini speech. Try to get like a mini speech on how to teach a squat in under 30 seconds, how to teach a deadlift in under 30 seconds. The more repetition you have, the more common that you do it, it'll help. So even if you take a year off training, it might be a little awkward to re-engage like your speeches, but you just have to practice. Make sure you demonstrate. We show, tell, do. So we always demonstrate before we throw the client in a machine and just try to figure it out. You demonstrate first, and then we telling them the details. It's called SAMSE or whatever because the first letters, the acronym SAMSE, is starting position, alignment, movement, safety, engage. It's a good way to remember you're not missing anything. So if you can remember the acronym, that's why we highlight that. Have the client perform the exercise and then detail it again. Let them know common errors, but be alert and prepare to modify or progress the exercise. This is an exercise continuum. We used to have a big arrow, and it was an arrow that pointed to the right and to the left, and in the middle is 5, on the all the way to the right is 10, all the way to the left is 0. We always want to program in the middle. But I like this picture better than the arrow. Let me see if yeah. So I like this picture better than the arrow because it shows the differences between simple and complex movements. We want to make sure that we are teaching somewhere in between this line. You see how like there's gray represents simple, blue represents complex. Simple would be maybe on a scale of 1 to 5, complex on a scale of 5 to 10. Everything that you program should be at like a 4 or 5 so that you can regress it and progress it. For simple movements, movement is pretty basic and bilateral, meaning we're not really introducing lunging or one limb things yet. Pretty stable, performed on a stable surface, partial range of motion or normal range of motion. Body weight, that would be like a 1 out of 10, right? Slow, simple, and then machines. As you see more complexity, or as our client gains experience, we can do free weights, more modalities, move a little faster, more load, full range of motion, add instability. Remember, we're only manipulating one factor at a time to prevent overtraining, but then we add unilateral movements and then novice. So it's good to program right here in the middle and say in the middle would be a goblet squat. A 1 out of 10 on a goblet squat would be a body weight squat or a chair squat. And then a really complex squat would be like a barbell back squat or maybe a split squat. So we always want to program at that 4 or 5. Make sure that you can regress every single thing that you program. It's going to take some time to have that on in your head, but you can always write that down. You can have a couple guides, but we're always programming at a 5 on a scale of 1 to 10 so that we can progress and regress on the fly. All right, this might be one of our last 2 slides. We talked a little bit about this on the weekend when we went over bench press. And this may come up again in the programming lecture, but when we're teaching supine exercises on a machine, same for prone, there's 5 points of body contact. They're going to differ between each. Supine exercises are on your spine, so bench press is a good example, or the floor. And then prone is on our belly. So think like a prone hamstring curl. You're lying on your belly and you're curling your heels to your glutes. That's going to be like a prone hamstring curl. I'm trying to think of another one. There's tons. 5-point body contact position for supine means that, say we're bench pressing, the back of the head is on the bench, upper back and rear shoulders. So just upper back, rear shoulders, the lower back and buttocks. So your butt is on the bench, your glutes, and then right foot and left foot. Ideally the whole foot, but if it's a the most of your foot, that's fine as well. As long as they could press into the ground with their left and right ball of the foot, should be pretty good. The whole foot would be ideal. So common question is, well, if my client has an arch, is that proper body position? Absolutely. If they have the back of the head, upper back, buttocks, right foot, left foot, there no in none of these bullet points it says the spine has to be on the bench. So arch is completely fine. It also helps stretch out the chest. There's this natural lumbar arch anyways that might happen, and that is completely fine for bench press. Well, of course, there's some people with low back issues. So with that, we can elevate the feet on a platform so they could push on the feet, but maybe the knees are not lower than the hips. And maybe there's other variations too that we can do for those individuals who would have a some type of compression with the back arch. And then we have 5-point body contact position for prone. That's on some type of machine, like I said, like earlier, like the prone hamstring curl. So we would have the chin on, so kind of like the back of the head. Instead, it's the chin because we're prone. The chin, or sometimes it's uncomfortable because of machines or cleanliness or whatever. It could also be the cheek of the head if we're turned to the side. So we're somehow our face is contacting the machine. Then we have our chest and abdomen in contact with the machine. Then our hips in front of the thighs. So basically the hip area. And then right hand and left hand. Usually there's handles to hold on to, and we're holding on to those. Last slide of today is continuing on with fundamental technique guidelines, breathing considerations. So this picture is really cool. It shows what's happening when someone's performing a breathing technique. Recommendation about how and when to breathe during exercise. We exhale through the sticking point or the concentric phase and inhale during the easier part of the exercise. The Valsalva maneuver is covered in your book. It's a breathing practice where an individual seeks to exhale against a closed throat. So what that does, it creates intra-abdominal pressure supporting the vertebral column, kind of making your own weight belt. Should only be used by resistance trained individuals when performing structural exercises. And clients with any known or suspected cardiovascular, metabolic, respiratory condition should not be doing the Valsalva maneuver. It's contraindicated. But as you can see in the left picture, there's a closed glottis. By holding the breath, they're creating air pressure in the lungs, increases and exerts force against the anterior surface of the vertebral column. Abdominal muscles are contracted. There's fluid pressure in the abdomen, increase and exert force against anterior surfaces, again, of the vertebral column. And the erector spinae is engaged. So we'll stop there for today, and we'll have a part 3 coming soon. Thank you, everybody. I hope you have if you have any questions, let me know. And if you have, hope you have a great day.